We were struck. We were very surprised. Children were born and immediately randomized to either a homeopathic treatment or conventional treatment, and they were in that allocation for 2 years of life. The results that you saw are highly significant, even with a small trial, which really, I think.
Hello, dear homeopaths. This is Barbara Liberowicz, Homeo Sapiens. My guest today, very special guest today, is Dr. Roy Singer from Jerusalem, Israel. As last year, after Sevilla IGA Congress, I decided to make a webinar with the best presenters of the Liga. And I invited Dr. Roy Singer to our Saturday seminar. But for some reason, Dr. Roy cannot take part personally, so we decided to record him before. Welcome, Dr. Roy.
Thank you, and thank you for the invitation.
During Liga Congress, you presented your new study, which was quite astonishing.
Thank you. We're very proud to have such a study to be able to show.
Could you please tell us about the background, about the design of the study, and what was it? What was the idea?
This is a unique study design conceived by my colleague, Dr. Menachem Oberbaum, by the way, which is a way to do a homeopathic randomized controlled trial with avoiding the limitations of a typical RCT. The idea was to randomize children, Indian children, to either homeopathic treatment or conventional treatment for all their acute needs for first 2 years of life. Children were born and immediately randomized to either a homeopathic treatment or conventional treatment, and they were in that allocation for 2 years of life.
As I understand, children from homeopathic group could receive conventional treatment support if necessary.
Yes, we were concerned about ethical considerations that someone might say you endangered children. So we allowed homeopathic medical treatment, conventional medical treatment for children in the homeopathic group if a doctor, pediatrician identified any risk to health or safety.
And the poor children from conventional arm could not receive acute homeopathy, just in case.
Not within the trial.
Why did you decide to make the study in India?
India is a perfect place for homeopathic trials because India has a very advanced medical system of homeopathy, and also it's widely accepted among the population, as opposed to the West, where users of homeopathy tend to be unusual people or exceptional people. In India, it is very mainstream to use, they call it Ayush, is all the alternative medicines, among them homeopathy.
So let's go back to the trial.
So this is the name of the trial, Homeopathy versus Conventional Primary Care in Children during the first 24 months of life. Results of a pragmatic randomized controlled trial. And it was an India-Israel collaboration. The burden, I'm not going to go, burden of pediatric disease in India is well known. I'm not going to dwell on that. And we know that medicine does not often have much to offer for children with viral diseases. And many of the diseases of childhood, even if it's bacterial, but maybe antibiotics is not the best treatment for diarrhea for children. Dr. Oberbaum had how can we circumvent the problem of doing a typical RCT with homeopathy, which is typically one medication, one indication, one outcome. And Dr. Oberbaum had this idea of offering children all their primary care for first 2 years of life. And this is comparing paradigms, not just one treatment. And this is the name of the trial. We mentioned that earlier. So we took 100 children and randomized them to 50 in each group of homeopathy or conventional care. They got treatment for all their acute illnesses for first 2 years of life. And as you mentioned earlier, offered conventional backup for children considered at risk in homeopathic group. And this trial was registered in the clinical trial registry of India. And the site was an amazing homeopathic hospital in Telangana of India, and the hospital offers both homeopathic and conventional medical services, among other things. This is the flowchart through the trial, and we started out with 218 children, ended up with 50 in each group, and lost to follow-up similar in each group. So we don't feel there's a big selection bias here. The biological characteristics or baseline characteristics of our children were similar in both groups. The families, I should say, similar in both groups, not a big difference in either group. the outcomes, primary outcome was sick days, and then we had other outcomes, sick episodes and other outcomes, which were secondary. And we can see in the results section that children in conventional group had more sick days in respiratory disease, febrile illnesses, skin infections, more in events in the conventional group as compared to the homeopathic group. These numbers, they're starting even without statistics. You look at the numbers in red and you say, wow, there are more events in the conventional group than in the homeopathic group. We looked at this statistically, and we find that the primary outcome, which was sick days, was highly significant in favor of homeopathy. You see this is a very strong p-value. Sick days and episodes, both highly significant in favor of homeopathy. Respiratory illness is also highly significant, both sick days and episodes. And secondary outcomes were less significant. Diarrheal illnesses, no significant difference. Growth was small advantage for homeopathy in size and arm circumference. Weight and head circumference, no differences. And development, no differences. Interestingly, the costs, homeopathy was much cheaper, half the price of conventional treatment. And prescription antibiotics, unsurprisingly, much less in the homeopathic group. That was significantly significant. This is what we gave. Typically, the common prescriptions in the homeopathic group were well-known homeopathic remedies, and conventional group, we're not surprised by what we see here. The highlight of the trial, over a 24-month period, children in the homeopathic group experienced fewer sick days than those in the conventional group, fewer sick episodes, and fewer respiratory illnesses. They have required fewer antibiotics, and the treatment cost was lower. There's no difference in development among the groups, and we are now looking for funding for a larger, more definitive trial. This trial was born out of a memo of understanding between Israel and India back in 2018, among other things in homeopathic research. And this was published, the trial was published in the European Journal of Pediatrics, first quartile pediatric journal in October 2024, and the results were well publicized in India, less so in the West. And we are now, after the successful publication, we've been threatened with retraction. We are trying to convince the authors, the editors, to renege on that, and we feel they have no strong basis for retraction. We hope that they will accept our appeal to retract the retraction threat. That's where we stand. Thank you very much.
What comes to my mind that sometimes this retraction threat is adding up to publicity in some paradoxical way.
We have not done that yet, but you are right. If it's retracted, we will do that, I imagine.
Were you surprised with the outcome of this, with the results, or you were disappointed? What was your reaction when you saw statistical results first?
We were struck. We were very surprised. This trial was small because of the limited funding we had. We had very limited funding available to us for this trial, and so we were able to get a minimum of 100 children. We expected to see only a trend. We did not expect at all anything significant, but the results that you saw are highly significant, even with this small trial, which really, I think, thunderstruck by that. And that's why we're so proud of this trial, surprised and proud. But we feel we need to repeat the trial in a larger sample size to be fully convinced of the findings.
As we saw, these are quite common remedies. These are remedies that, after all, we could have expected for arsenicum for diarrheas, or belladonna or chamomilla, like very frequently used childhood remedies.
Yes, that's true. But we trust the Indian homeopaths, who are very highly trained. And, the remedies are common, but you still have to know when to give them. And they were able to choose, we believe, choose remedies well and prescribe accurately. We're very pleased with our Indian colleagues and their homeopathic experience and the knowledge. We have excellent collaboration with our colleagues in India. This is the team that performed the trial. Dr. Orobaum here on the left conceived the trial, myself here on the right at the bottom. But this large team in India performing the day-to-day work on this trial was a lot of work, and they were very dedicated, very exacting, and we're very pleased to work with them. We hope to be collaborating with them in the future, more research. Amazing team, and they did amazing work. We had a few comments from our reviewers when we studied why was it not placebo controlled. It was randomized, but not placebo controlled and not double dummy. And why is that? We want, in terms of ethics in this day and age, after the Helsinki Declaration of 2013, the standard of care is to do RCTs versus the confirmed, the known safe treatment. In other words, we can't do a placebo trial if you know you have effective treatment otherwise. And we know that conventional treatment is at least considered effective for pediatric diseases. So it's not really ethical to offer a trial versus placebo. Now, the other option was double dummy, would have been very, very double dummy, meaning for each child to get both a placebo and a active medication for each different change for each groups. That's very complex pragmatically and ethically not so sure that would work, because parents should know what their children is getting, and the doctor has to know what the child is getting. So we thought ethically that would not work.
You can give placebo granules, but it would be difficult to give placebo nebulization or placebo IV treatment.
Very, very challenging. So that's why we opted for the open label model.
Thank you, Dr. Roy. It was nice to have you here. We hope to see you again. And this video will be available at the time we have Best of Utrecht webinar. And for you all, for all homeopaths, if you want to check our other interviews, please go to our playlist, Homeosapiens interviews, links in the description below.
Thank you for the invitation.